Thank you very much for that introduction and for allowing us to speak at Prof again. Fiona and I are delighted to be here. I'm sorry it's in English. I understand Flemish very well, but you don't want to hear me speak it. Our third colleague, Claire, has moved to the UK since we did our presentation in May. So Inga Wellbeing has already gone international, so it's a great big step. So to explain for those who haven't seen us before, Inga Wellbeing is a project to create attractive and comfortable clothing for those needing medical treatment. In order to explain the concept of Inga Wellbeing, I need to introduce you to somebody who has very much inspired the whole idea. And that is my mother, Inga, who at the age of 52 was diagnosed with ovarian cancer and underwent 3 years of grueling medical treatment, during which time she lost not only her hair, but also her self-confidence and sense of self. Dressed in either the hospital gown or her home clothes, she was dependent upon nurses, strangers, to help her dress and undress, and was in her nightdress when the doctor and his entourage of junior doctors would pay her a visit. She just seemed to disappear in front of my eyes. Not only was cancer threatening to rob her of her life, but the process of being treated for cancer was robbing her of everything that made her her. And I was absolutely incensed and determined to change something. I wanted her to feel herself and to be seen as more than a patient, a person. The problem, it seemed to me, had a great deal to do with her clothes. So she either had the choice of a hospital gown, which is a unisex, one-size-fits-all garment, or home clothes, which lovely nurses would be prepared to put her in and take her out of, but in reality she had to wait for them to have the time to do that, and they're just not fit for purpose. Home clothes are not meant to be worn with drains and to be taken off and put on again for regular examinations and treatments. Often, in the end, the patient ends up feeling less dignified, less covered, and more awkward. And unfortunately, her experience is not unique. You can see in the top right corner, Claire, whose own motivation for joining Inga Wellbeing and helping to create this is that her mother had breast cancer, and her experience was much the same. And indeed, many people, again and again, that we've met have spoken about this being a key issue. During this time when life expectancy is on the rise, the number of elderly has gone up significantly, and the incidence of chronic disease is rising, there are of course more and more people needing medical treatment. Indeed, unfortunately, 1 in 2 of us will have cancer during our lifetimes, and 1 in 11 of us already has diabetes, and this number is rising. As a result of this burden on the healthcare system, there is a move towards more at-home care. But yet again, in this situation, our clothes simply are not appropriate. It's time for a new look of what to wear during medical treatment. And we can see already, beginning in the United States and coming across to the UK, a real trend to changing what patients are wearing. Indeed, the Cleveland Clinic, for example, has completely overhauled their hospital gown. It remains a hospital gown, but it is certainly more dignified than before. And individual patients in the United States are coming up with solutions. They're very condition-specific. It might just have one opening for a portacath or an arm opening for dialysis. But nevertheless, they are coming up with solutions and they are having them crowd-funded. But they're essentially made-at-home garments. There's nothing really still out there, generally speaking. So what was our vision? Well, we want to create clothing that helps individuals with medical needs keep their dignity, independence, and sense of self. And we want to help those that care for them to do so with ease. So we absolutely want to empower both the patient and the caregiver. And now I'll pass over to Fiona for her to explain the clothes that she has been so instrumental in creating.
Through my own story of chronic depression and chronic anxiety, I understood that feeling good from the outside had an absolute huge impact on how we feel on the inside, and thus empowering us to face life's challenges. And so my challenge in this endeavor was to try and create a collection that would combine both beauty and functionality, comfort and practicality. And I have been very privileged to do so with the help of my partners, doctors, nurses, patients, and many others. This is how patient clothing can look like. I think you would agree that we have fundamentally changed the way they can look. This is the women's and men's collections to date. And you may have noticed that I and Claire are actually wearing patient clothing. What's very important is that we all look completely normal and hence more confident. These clothes can be worn by all ages, and all the functionalities have been hidden discreetly to reduce the stigma of ill health so that you can see the person and not only just the patient. So our clothes are suitable for all medical conditions as verified by oncologists, urologists, cardiologists, stoma nurses. They are, they promote self-confidence and independence. You will feel less embarrassed and more empowered to go down to the cafeteria. And so you will be feel less alienated and promote sociability. Nurses will be able to provide more care with more ease. And we could imagine in the future sort of variations of our clothing with the integration of smart technology. So to go more into detail of the men's pajamas, for example, here we have the men's pajamas. We have worked consciously with natural fabrics, which are moisture wicking and control body odor. We are also working with other manufacturers to try and find more performant fabrics at this moment. The fabrics are made in Jersey to promote maximum comfort, and we have also integrated different elements to tighten and loosen the garments, also for maximum comfort. So here we have all the different functionalities. You will see full arm access, which is absolutely vital if you're hooked to an IV line to be able to dress or undress independently. We have access to the back for to listen to the lungs or back massage, or if you have a port-a-cat or a feeding tube or a central line. You can wear these clothes without having to undress completely, hence keeping your dignity. Men can wear trousers with confidence. It means you don't have to wear the dress. We have full leg access for physiotherapy, for compression stockings, or if you have a catheter bag to change it. And we have full groin access, which means you don't have to pull your trousers down, which quite frankly is a very embarrassing, annoying, and sometimes humiliating gesture. And this is the women's night dress. I'm actually wearing the day version of the women's night dress. We've integrated a lot of user-friendly elements, which is absolutely crucial. We have developed contrast snap tape to improve visibility, especially for the patients or work caregivers in the evening when it gets dark, or if they need to wear glasses. We have also, it prevents the snagging of IV lines, which can be very painful, and we have no metal parts. So again, these are the different functionalities. We have full access to the back. This, if you are bedridden and if you need a bed bath, if you have, you need regular toilet visits, if you get bed sweats as well. We have generous coverage at the back, so no bums hanging out. We have access to the tummy and to the abdomen for stoma and feeding tubes. Again, full access to the arm to be able to dress and undress independently, even when hooked to an IV line. And again, access to the side for heart monitors or feeding tubes. And these are the values of Prof. I can say a few: respect, non-stigmatizing, anti-loneliness, security, dignity, empowerment. And these are also our values and integral to absolutely everything we do. So what did we do? Well, we actually went on a roadshow. We went to the UK, and we went around Belgium, and we visited hospitals and clinics and patients and nurses and caregivers and loved ones, and our clothes and designs were warmly welcomed. These are the different medical institutions we have met so far in Belgium and in the UK, and the different patient organizations we're working with. And today, 10 hospitals have expressed an interest in exploring ways of getting these clothes to their patients. We have received an incredible amount of endorsements from different people that we have met. And I'd just like to quote Jacques Peters, who is a senior nurse at the Jules Bordet Institute in Brussels, where he says, Inga Wellbeing clothing enables medical staff to examine and even treat patients easily and without having to fully undress them, maintaining patient dignity and comfort and saving valuable nursing time. Patient testimonials, we've had tons of them as well, and the key words that keep coming up are, I felt more confident, I felt normal, and I felt less sick. And so now I'm going to pass back to Nikla, who will explain to you a little bit how the clothes have been brought, or how they will be brought to market.
So obviously the end user for our clothes are the patients, but both inpatients and outpatients. We hope that we have in our collection items that can be worn with, say, jeans, and you wear a simple top, so you can go in for your dialysis or for your chemotherapy. So both inpatients and outpatients are the end users, but they could also be our customers themselves, but also their friends, family, and colleagues who are desperate, in fact, to show that they love an individual who is going through a difficult time and to support them and don't know any practical way that they could help this patient. And in fact, in our first sales, which since the Prof we've begun, it has been by and large loved ones that have bought the clothes. So that's a really key element. But others, and at this point I should also say that whilst we have a consumer range currently and a small stock of it that we're beginning to sell, we are trying to develop an industrial range that would be washable by the laundries and therefore actually available for the hospitals to provide to their patients. So there's two ways that patients might be able to receive these clothes. And as such, these organizations as well will play a really critical role in getting the clothes to the patients. Obviously, we are approaching private healthcare providers, hospices, clinics, residential homes, both in order to see if they would carry the consumer range in their shops, and also indicate to their patients where they could find us online, but also if ultimately the industrial range works, as we hope that it will, to possibly also provide the industrial range to their patients for a daily fee. Laundries will be extremely key in this arrangement. The Mutuelle as well have a very big role to play here, as do charities and corporate sponsors who we understand might be interested in buying a certain number of the clothes and giving them to a ward. And finally, we hope that one day public hospitals too would be able to provide these clothes to patients and in such a way that it doesn't cost them any additional money, that the money is covered. So right now and in the near future, how will patients get our clothes? The consumer range, as I've just discussed, is available on the Inga Wellbeing eShop. It's already live. We've already had our first sales. We have 3 items for sale, and they're the ones that are on our stand at the front. They're all in navy blue right now. Over time, as a startup, we hope to introduce more colors, but we have the small issue of minimums to overcome. Specialist online retailers, bricks and mortar retailers such as Bondagiste are also selling them for us currently in this test phase. And in the future, with the industrial range, we will work with our manufacturer, a Flemish organization called Alsico, to approach private clinics and hospices and the such. So where do we stand now? As Fiona has explained, we have our designs, we have our prototypes. They've been tested and given a warm thumbs up. We've begun to get the word out with articles in Journal du Patient, but also in the Metro and others. And we have a growing social media presence, as well as participation in patient events. And we've had our first sales. So we definitely feel like we're becoming real, which is exciting. In the future, we hope to increase the collection to also cover teenagers, children, and babies, to incorporate smart technology, and to use other fabrics, such as a luxury range and nanotech fibers. How you could help us at this stage would be to spread the word, to spread awareness of this concept, because in itself it's very new, to send people to our website, follow us on Facebook and Twitter. You can find all sorts of fascinating articles about patient empowerment, just the subject that we've been here for the last 2 days on, and generally help us. In November, we're also going to launch a crowdsourcing campaign. So to finish as we started, with somebody who has inspired what we do and is the reason that we stand up here and continue to work till 2 or 3 o'clock in the morning, I'd like to introduce you to Bea, a 17-year-old who is passionate about horse riding and was a member of a very successful female soccer team. Unfortunately, Bea was at Zaventem on March 22nd, and she has spent many months in the intensive care burns unit. She has lost both her feet, and she is partially paralysed. But her headmistress asked that we send her some of our prototypes because she saw her in the hospital gown and it just didn't seem fitting for this 17-year-old. And we did. And we received this photo from her mother, which we are sharing with you with her permission, of Bea wearing one of our prototype dresses and a little visitor who came to see her. And I'm delighted to say that Bea has since left hospital. She's been to rehab and she's now at home. She's even back at school and she hopes to graduate with her peers this year. And I think you would agree that Bea is more than a patient. She's a person, an extraordinary person, and we all are extraordinary people and deserve to be seen as such, whether we're ill or not. Thank you so much for your attention. And I'm just going to give you one last slide, which is to say we haven't done this alone. We're extremely supported, not just by Prof, but by many others. Thank you very much.